This is Carmen Daniels presenting her Transcultural Nursing presentation. I chose to do my presentation on Indian healthcare and Hindu traditions. Healthcare in India is minimal at best. Most citizens don't have private health insurance because they can't afford it, and most of the people in Indian culture have to pay for their healthcare services out of pocket. In this presentation, I'll be describing the conditions of healthcare across the lifespan, and the average Indian citizen, as well as demonstrate what people from this culture feel as health. Most Indian people are Hindu and have specific beliefs when it comes to healthcare, such as karma and fasting, particularly on holy days, and some even believe in fasting during hospitalization. So I'll kind of go into how the Hindu religion affects the healthcare provided to these individuals. Healthcare in India, like I said, very minimal at best. There is low levels of private healthcare coverage, and most people have to pay their healthcare payments out of pocket. There's a low level of public sector expenditure and high levels of catastrophic healthcare payments. All of these characteristics make it to where most Indian citizens fall below the poverty line. On top of that, 70% of the Indian people live in areas where there is limited to no access to hospitals and clinics, so that also puts a major damper on the healthcare in the country of India. Hindu beliefs have a big effect on healthcare as well. Most Hindus have diet restrictions. They don't eat beef or pork, and many of them are vegetarians, so there's diet stipulations that come into play as it comes to healthcare. They fast a lot, especially on holy days, and most Hindus even fast while they are hospitalized. So that's another thing to keep in mind as a nurse or a healthcare provider. There's a lot of things that they believe in, such as the evil eye, where they feel that a stranger's stare or glance could actually bring evil spirits and can cause harm to them. So that's another thing. You may see trinkets or something in their room to help protect against these things. And Hindus feel that all illnesses, whether it's mental or physical, have a spiritual, biological, and psychological element. And if all three of these elements are not addressed, then they feel that their treatment is not effective. And they may also feel that their illness or what have you may be as a result to karma. Karma is the belief that every action builds up and can affect their future. Reincarnation also has a play in this. They sometimes may even feel that things that happen to them, such as illnesses and bad things, could also be as a result of karma or even actions from a past life. And so all of these actions, like I said, it can affect their current health and their well-being. And this may actually come into play when they have to make healthcare decisions. Sometimes if they feel that whatever has happened to them because of a past action, they may not want to do much about it. Pain can actually be a factor in this. They may not be as forthcoming to how much pain they're in because they feel that it is a result of their karma, so they just would rather suffer through it. When it comes to maternity and healthcare, India actually accounts for 1/4 of all the maternal and infant deaths across the globe. On top of that, affordability of the healthcare is the main reason for poor maternal care. For example, in Bihar, one of India's poorest states, 80% of births occur at home, and 50% of those were due to the mother not being able to afford going to an institution to deliver her baby. This also even occurs because with India's free of charge maternal health care, they may get their prenatal care, but they still can't afford to go to a hospital and deliver their baby. And like I said, since many of these people in India live in places where they cannot get to a hospital or a clinic, that also factors into that as well. There's also specific ceremonies that have to be performed during pregnancy or just after birth. One of these is the Jatakarma. This welcomes the newborn into the family. And then another one is a Namakarna. And that is a naming ceremony. And I actually have a picture here of a naming ceremony being done. This is usually done at the home. So it's not surprising for a nurse on a postpartum unit to get told that they're not naming the baby until after they go home. And so sometimes the newborns may actually even be named, way later, especially if it's a baby that has a lot of problems and there's an extended hospital stay there. So it's kind of to be expected that the baby will not be named at the hospital. As far as children go, pediatric care in India is well behind other countries with their pediatric care. Most children are born underweight, and 7% of them die before the age of 5. PICUs were not in India until the early 90s. The first PICU was established there in the early 90s. This really did enhance pediatric care, but they're still really far behind other countries, and there really does need to be a lot of strengthening of resources and research that needs to be done so that the pediatric care in India can improve. Hindus believe that children are results of karma, and so that they're a gift from God. So because each child, and because, they also believe in reincarnation, each child is a reborn person, so they believe that all people are connected, so they cherish their children, especially boys. It used to be that grandparents would actually stay in the home and live with the family, and the grandparents were very strict about making sure that their grandchildren were taught about Indian heritage and language and religion. This doesn't occur so much more now. They're kind of modernizing a little bit, and they're a little more liberal now with raising their children. But people who may be still very strict with their Hindu practices, you may see the grandparents being very involved in a child's life and making sure that they're raised the way they feel that they should be raised. As far as older adults, the families are very much involved in caring for the elders, especially the sons. It's actually an obligation for the children to care for their aging parents and their sick loved ones. So when we get Indian patients admitted into our hospital, we need to understand that they're going to have a lot of family there, and they're going to want to be involved. So as nurses, we need to make sure that we are aware and respectful of the family and involve them as much as possible, because they feel that it is their obligation to make sure that they are taking care of their loved one. When someone is dying or in the process of dying, there are certain things that need to be done. There are things called tulsi beads, and I actually have a picture of them here. And these are a religious jewelry that needs to be placed around the neck while the person is dying. And they believe that the beads have to be on the body at the time of their death. If for whatever reason, if the neck is not available, due to healthcare interventions, it's required that it be placed on the right wrist instead. The body is usually washed by a close family member, usually the oldest son, and they also believe that all jewelry and religious items such as the tulsi beads need to stay on the body. So if for whatever reason there is an issue where these items may need to be removed, they need to be educated by the healthcare staff about this, because they're going to be very adamant about making sure that those items stay on the body. And they also believe that the body should be cremated as soon as possible after death. Hindus believe that their destiny and their past actions and karma actually determine the time of their death. They do not believe in treatment that may prolong the final stages of death. So you may see a lot of, DNRs or things of that nature with these patients. With that being said, they do not believe, they're very, very strict about suicide and euthanasia. These are not things that should be done as a means to further or, bring that dying process on sooner. Most Hindu people wish to actually die at home, and the oldest son is actually to be present before, during, and after the death, and that is even if that son may be a small child. Sons are very, very important in the Hindu religion, and so you see a lot of rituals and stuff like this that require the oldest son, to be present. So if you are dealing with a dying person of Indian culture and you see a small boy in the room and they are very adamant about not removing him from the room, you just have to keep in mind that that is a religious thing for them, and for that son to be there is very, very important. Overall, just as a summary, Hindu practices do place a lot of stipulations on healthcare. These stipulations actually may affect their healthcare, so as nurses, we need to be really aware of all of these restrictions, whether it's diet or religious restriction or something like that. And it's very important for us to ask our Indian patients about these customs that they have so that we can provide holistic care to these people and not offend them in any way, or make it to where they feel they're not being treated adequately. And like I said earlier, family plays a very big role in their healthcare, especially with the sons. You see this a lot with the older adults in their healthcare. So, like I said earlier, just being very respectful of the family and their customs and allowing them to be there is very important. And as mentioned before, healthcare in India is very lacking. Most people don't have healthcare coverage that they need, and a lot of this is due to financial burdens or even possibly where they live. And a lot of them, if they do wind up having to be in the hospital, they're going to have to pay for it out of pocket, which puts them below the poverty line and, could possibly even damper the, financial situation in India even further. And these are my references that I've used. Again, this is Carmen Daniels presenting her transcultural presentation. I hope you enjoyed it, and I hope you learned something about the Indian culture. I know I sure did. Thank you.